Hello, I'm Barbara Defazzio, President and CEO of Circle of Friends Services. Circle of Friends Services is an outpatient community mental health provider in Central Florida, and we serve the needs of families and children mostly in the child welfare system. And in recent years, we have begun to serve families and children who are going through the post-adoption process. We come to you today, and I come to you today, as part of our ongoing series that we're providing to adoptive families to discuss some of the more common and very normal experiences that families and children go through in the post-adoption period. So we hope that some of this will be helpful to you as you go through the very exciting but sometimes very scary process of assimilating a child into your family through adoption. Today I would like to talk to you a little bit about adoption and the opioid crisis. Because if you have adopted a child from the child welfare system in the past 5 or 6 years, it is very likely that in some way your child has been affected by the opioid crisis. The opioid crisis in the United States reached epic proportions and peaked probably about 2016 when 64,000 people died of drug overdoses in the United States. And our country spent over $500 billion trying to combat this problem. But here we are in 2018 and we have not been successful. So what we are seeing is that the whole crisis has shifted the child welfare paradigm. Many years ago, we saw children being subjected to extreme physical abuse, sexual abuse, abandonment, neglect. But now, even though those things still exist, most of what we are seeing in child welfare is that the very number one reason that children come into care now is drug abuse on the parts of their parents. So children who have come from drug households can be affected in 2 different ways. They can be exposed to drugs in utero, or they can be exposed to just a very basic lack of care in the early years of their life. Many, many more children have come into our system of care in the last 5 years, born into some type of in utero drug exposure. And we also often don't know what that is. It is very important that we try to find out when we are assessing our children's needs what the drugs were, when they were exposed, how often they were exposed. Was it a variety of drugs? Was it throughout the pregnancy? Was it one time? In utero exposure is something that can be very damaging to a child. We're going to talk about the ways that you can deal with that. But first of all, I would like to say to you, if you have adopted a child that has been exposed to in utero drug exposure of any kind, don't be afraid of it. Try to find out as much as you can about it. Try to find out as much as you can about the circumstances of your child's birth so that we and you together can put together a plan to help remediate some of this. We are seeing children that have come into our system with certain types of drug exposure that cause them to be very unable to regulate their emotions, unable to calm themselves down. The most common thing that we see across the board, whether it's exposure to cocaine, methamphetamines, barbiturates, opioids, cocaine, heroin, no matter what it is that our children come into care with a basic inability to regulate and calm down. So this often looks like ADHD, and you will think that your child has ADHD, and maybe it is not that. Maybe it's something else, and we need to take a look at that. So that's the number one reason that your child might be affected by the opioid crisis. The second thing that we're seeing is that children, especially very young children that are raised in drug households, often just have a very basic lack of care. Unlike children of a few years ago that our primary issue with them was physical abuse or sexual abuse, these are children that have just had parents that were totally unavailable to them. Parents whose drug addiction has totally taken over their ability to take care of their children. So most of the children coming into care in the last 5 or 6 years have been under the age of 5. Most everything we learn in life, we learn in the first 3 years of life. So if you've had a basic lack of care in those years, you are going to have deficits. I will give you an example of what I mean. I recently spoke to a grandfather who had taken in his 5-year-old child, a grandson, who had been raised in a drug household. And this grandfather said to me, my grandson could not count to 5. He didn't know the alphabet. He didn't know colors. He didn't recognize basic things like chicken or broccoli. He knew McDonald's Happy Meals. He did not know how to play. He didn't know what Play-Doh was. He didn't know what crayons were. It's hard to really understand what happens to a child when they are just not cared for, but they do not develop normally. They don't develop the way we want them to. If you have had a child coming to you from a drug household, basically they probably have had lack of care. Now, what can you do about this? You can remediate this. This is the good news. I've given you all the bad news first. If your child was exposed to alcohol, we have to face the fact, and you as an adoptive parent must face the fact, that fetal alcohol exposure is very, very difficult for a child. It is basic brain damage. Does that mean that your child cannot be successful in life? No, it doesn't. It means that you and that child have to go on a journey together where you learn about the effects of fetal alcohol, you learn about the effects on the brain, and you put together a treatment package, either yourself with a helping therapist or a doctor, and try to help remediate and help that child make up for some of those deficits. Will it ever completely remediate itself? Fetal alcohol is the one exposure that does not remediate itself completely, but your child can be successful and you can provide your child with a wonderful life. As for the other drug exposures, you are going to find that there are certain very basic things that you can do for your children, not only if they have been exposed to drugs in utero, but if they have been raised in a household where there was lack of care. You can put together very, very basic kind of brain retraining for your children. The good news about children under the age of 5 is that their brains are wired to attach and to learn and to reach out and to connect and to love. Those wires have not been broken. Those wires just haven't been connected. And you can do that for your children. You can set up very, very consistent caretaking routines. And they can learn very, very quickly the things that they didn't learn when they were in a household where there was no care. In the case of the grandson that I just spoke about, within 6 months, this child knew his alphabet. He knew numbers. He knew colors. He was drawing. He was doing very, very well in pre-K. This is a child who caught up very quickly because the wires for connection were there. And he just needed caring adults to help him connect those wires together. So the bad news is that we are in a really dreadful time in our country in terms of drug overdoses and its effect on the American family. The good news is that you as adoptive parents have chosen to bring these children into your home and to try to help them reconnect, pull all those wires together, make those connections, and become healthy, functioning young children. And you will be able to do it. You don't need therapists to help you, but we're willing to help you. But you can do this. Just know that even though these effects are there, you can help remediate them through your kindness, through your consistency, and through your love. I hope these remarks have been helpful to you, and I hope if they are, that you will go into our YouTube adoption series and look at some of the other short videos that we have put up that we hope will be helpful for you in your post-adoption period. Thank you very much.